Hi, I'm Kelton. I'm an internal medicine physician with the Central California Faculty Medical Group, and we represent UCSF in Fresno. I'm here to talk to you about men's health. June is Men's Health Month, and it's an important time to think about ourselves, especially with Father's Day coming up, and our own health and how we can contribute to the health of our families by paying attention to our own. I see a lot of men in my practice, and many of my male patients are concerned about some things as time goes by, especially with aging. They're concerned about their energy, they're concerned about their strength, they're concerned about loss of virility, and they're also concerned about cancers too, all of which are very important. I think the first trick is to actually come and see your doctor and talk to them about your concerns. It's also important to know your own family history. For example, your own family history is probably the most important genetic test a doctor can still do today, even in the age of modern medicine. And from that, your doctor can talk to you about your risk of cardiovascular disease, that is heart attack or stroke, your risk of diabetes, and your risk of certain screenable cancers. So it's important to make a visit, and you can do this at any time once you're an adult male from age 18 and up. It's especially important after age 35 to talk to your doctor, even if you think you're healthy, about your risk of diabetes and high cholesterol. Men oftentimes will neglect sleep, and I think that's unfortunate because many of the concerns men have about their health, loss of energy, a loss of strength, a loss of virility, are associated with a lack of sleep. So it's really important to try to get 7 to 8 hours of sleep every night. There are some that may not need as much, but most of us really do. And it's easy to give up on some sleep in order to get more work done, to see friends, sometimes to go out and have fun. And every once in a while that's fine, but the average person needs 7 to 8 hours of sleep in order to feel healthy and be at their best. It's really important to eat well. Our diets will determine our risk for many diseases, including that of obesity, diabetes, and also high cholesterol and heart disease. The newest recommendations tell us that we should eat less than 10% of our foods from sugars. That is, most of us get way too much sugar. Secondly, it's also important not to add salt to your diet because the average person gets 10 times as much salt as we need, and salt contributes to high blood pressure. And high blood pressure itself is associated with the risk of dementia, heart attack, stroke, heart failure, and kidney failure, all of which are really important. So try to eliminate salt. Don't add salt to any of your foods, and try to cook without it. And if you don't cook, try to learn a few recipes. Moving well is really important for men. As we age, our loss of strength, our loss of energy, and our loss of virility actually has to do with the ways that we're behaving ourselves. The more a man exercises, the more energy they will have and the more strength they will have maintained. Most men can maintain the same strength they had as a teenager or early 20s well into their 40s, sometimes even into their 50s. Now, it's probably true you won't have the same endurance when you're in your 50s as you might have in your 20s, but still, exercise is very important for overall health and overall well-being. It's important for men to manage stress. Stress is a part of the modern life, and stressful things will happen to us at any time. Loss of a job, loss of a family member, difficulties in relationships. Managing that stress to be able to live well in the future is important for us and also important for those that are around us. Unfortunately, the things we oftentimes look to do, such as drinking alcohol, using cigarettes or other drugs, really does not help us in the long run to manage stress. It doesn't even really help in the short run either. Managing stress can be best done by things that we've already talked about: sleeping well, eating well, and if anything, maybe engage in more exercise. That's one of the best natural treatments for stress. It's also important to engage with others. That is, be with your families, hang out with your friends, spend time with your church or other religious groups. And it's also important to engage in other social activities. Many men during their working lives will socialize as part of their work, but then when work stops, they have no access to social activities. So it's important to develop some of those relationships before retirement and really engage them as time goes by. And that's one of the things that will help keep a man healthy into his later years.